What is the difference between a midwife, a doula, and an obstetrician? My name is Heather Shelley. I'm a licensed direct entry midwife and a family nurse practitioner. And the difference between all of them is kind of their skill level and what their responsibilities are. So a doula is a labor support person. She's not supposed to do anything medical. She may have some medical knowledge from very basic to more advanced. Basically, she takes the place of your mom, your sister, your best friend, meaning that she comes in and she helps you. She does the hip press, the knee press, she rubs your back, she helps you, educate you on decisions that you need to make. Kind of like a childbirth educator as well. So that is the role of a doula. She does not do catch the baby, she does not do heart tone, she does not do vaginal exams, she does none of that. Then you have a midwife. A midwife, I talked about in other videos, could be a certified nurse midwife, it could be a licensed direct entry midwife, it could be a birth attendant, it could be anyone that catches a baby kind of thing. So looking at that licensure is important. But they basically do everything inside the hospital, outside the hospital, at home, depending on the type they are and of midwife that they are. And they look at the medical side, but usually from a more holistic approach. Depending on the skill midwife is depending how much medical they can do. And then there is an obstetrician. Actually, there's a family doctor and that does obstetrics, and then an obstetrician. And the training is different between all of these. An obstetrician mainly does, they do a lot of C-sections, they're trained in that. Some family practice doctors do C-sections. It really depends where they are around the country, if the OBs push them out. More rurally, they do all the C-sections because there are no OBs. And the OB and the doctor typically does not stay with you in labor. They don't do labor support, where you're more likely to get that from the midwife and then of course from the doula. So there's kind of a basic breakdown. Doula is support. Midwife is your kind of her patient, I guess you could say. She does the medical side, and then the OB does the higher risk. A lot of women in this country do go to OBs first, and just I think something around 12 to 15% of births in the United States are attended by a midwife, where if you look at the UK, New Zealand, places like that, it's the opposite. Most births are attended by midwives, and only those that are high risk are attended by obstetricians.